So I do research on how the opioid crisis has affected pregnant women and infants, and I also am a newborn ICU doctor here in Atlanta.
Would you be surprised to hear that there were 70,000 mothers who were referred to law enforcement based on allegations, just allegations of substance abuse over a 6-year period, but 70,000 women?
I'm not necessarily surprised by that. We know, for example, infants are the fastest growing age group in the US child welfare system today, and most of them are there because of parental substance use. One of the things we've seen in the child welfare system in particular, it's a system that started out in the early 1970s to protect children from physical and sexual abuse. And what we've seen is just this growth over time, including to substance use. And I think we have to pause and ask, what are our goals and what are we trying to achieve? Because part of it should be to have healthy moms and babies and sort of step back and say, is this really achieving the goal that we want? Because referral to child welfare, it can be harmful within itself.
An average person who would hear that would say, using some kind of substance, whether you're using drugs, is harmful to a child. So what's wrong with that? The fact that you're having someone investigate that?
Well, look, there are many things that, women should avoid in pregnancy. The question is, what do we do about that? So, for example, when we think about things that we should avoid in pregnancy, alcohol is one of those things. So alcohol is the leading cause of preventable developmental delay in children today. So yes, we want to have healthy moms and babies. The question is, how do we achieve that? And do we really achieve that by drug testing women at the time of birth and referring them, to the child welfare system? And then what we see is the downstream effects of this. We see family separation. We see, a rising number of infants in the U.S. foster care system. That's not a solution.
In about half the states, marijuana is legal. And in other states, it's legal for medicinal purposes. So are you saying that like a single test that shows that a mother was using marijuana, she has THC in her system, can end up with her being accused of child abuse?
It can. One important thing to know is that women should avoid cannabis use in pregnancy. That's true. We know that there can be pregnancy-related outcomes that aren't as good as they could be from preterm birth. There's also some long-term data to suggest things like ADHD. But the question is, what is our approach to this? And is drug testing and referral, is that really solving the problem? I would say it's not. There are other conditions that I care for where we see evidence of potential harm, short and long term. Uncontrolled diabetes is one of those things. So I guess my bigger question is, what are the right vehicles to improve the health of moms and babies? We are flooding the system in many cases with newborns, many of whom can be low risk, and yet we have 3-year-olds dying of fentanyl ingestion. So our system currently isn't working in the way it was designed to. We aren't really protecting the highest risk infants, and we are loading the system with a bunch of infants in particular, and I think it's sort of distracting from the broader mission of the child welfare system.
Isn't that what's happening here? That you're reporting a mother because of a drug test, a positive drug test, but you don't know whether there was any kind of harm.
We don't know, and that's where the systems are deciding what is defined, and state legislatures are deciding what is defined as child abuse. That's where we have to have a bigger conversation. In a White House report, one of the main statements there was substance use by itself should not be considered child abuse. This is where we need to have a bigger conversation about substance use. What is child abuse? What is not? And I think the bigger question that I have is, where does the line stop? If we are talking about cannabis use in pregnancy, are we also going to tell women that they have to control their diabetes in a certain way? Where does it stop to what we decide is potential harm that we use the child welfare system? I think oftentimes we are testing in ways today where we aren't thinking about how we're using the data, and it almost just becomes surveillance.
You're not against the testing for drugs. You're against what happens if a mother gets a positive result. Is that what you're saying?
That is what I'm saying. I think we have to step back and think, is using cannabis in pregnancy, do we really think that's severe child abuse? And should we separate a mom from her baby and deem her unsafe for, being at a daycare or a teacher? I think that's where the response has been pretty extreme in different parts of the country. And that's part of what's happening with drug testing today. One patient I always think about in this space is a baby that I was caring for. It was a baby who was transferred to the newborn intensive care unit after about 2 days. This infant had pretty classic opioid withdrawal, was jittery, was irritable, but the mom denied any substance use. And I remember walking into the room and talking to her after the umbilical cord test came back positive for buprenorphine. This is a medication used to treat opioid use disorder. And the first thing the mom said to me was, "Are they going to take away my baby?" The underlying fear for almost every pregnant woman is taking away their baby or losing custody of their baby. But if we step back from that ecosystem, here's a mom who is getting a drug treatment for opioid use disorder because she can't get it. She's not willing to be forthcoming about her substance use because she's worried about the stigma in the system, and she's worried about legal and child welfare responses. The problem when we just focus on a punitive response for substance use in pregnancy, it drives women into the shadows.
What are the consequences often for when a mother is referred to Child Protective Services with one positive drug test?
I think the worry is that anytime there's a referral, it starts a track record. And even just that investigation part can feel like a lot for a family and can lead to potential separation. And we know that's not equal in the US either. We know, for example, Black women are more likely to be referred than white women with similar use patterns. We know that Black women, for example, are less likely to receive evidence-based treatment for opioid use disorder. And we also know that when children are taken away and placed into foster placement, Black infants are less likely to be reunified with their families. It's true that we see huge disproportionality in the system for Black women and for American Indian and Alaska Native infants too.
If a mother is caught smoking, will she be referred to Child Protective Services?
No, and we have good evidence about the harms of smoking. We know with great certainty what smoking causes. We know the same with alcohol. And yes, we don't refer in the same way that we refer for other substances.
I mean, let's just say a nurse saw a mother who's about to go in and give birth and she's smoking outside the hospital. Would she be referred?
No.
But she would be referred if she walks into the hospital and has a positive drug test, and it could be a false positive.
Yes, and I think this is where we have to step back and try to understand a little bit, what are we doing?
One of the people that we have talked to said, you're creating a harm in the name of trying to prevent a harm.
Yes.
What does that mean?
What that means is separating a mom and baby by itself is a harm. It is something we should take with great seriousness. It is an adverse child experience by itself. We do a really poor job of disentangling real risk with kind of broader low-risk families. The trend has been increasing over the last 10 or 15 years, where we've seen states more punitive in the response to substance use in pregnancy. This gets back at the question of what are we providing in terms of resources for treatment for pregnant women and wraparound services for infants. Right now, those systems are very fractured for most families.
When you say the states have become more punitive, in what way?
They're child welfare laws, whether that is what is deemed child abuse or whether that is mandated reporting policies. What we know about those laws is that they have not been effective at decreasing rates of things like opioid withdrawal in newborns. In fact, states with more punitive laws actually have higher rates of opioid withdrawal in newborns. We know that punitive approaches to substance use, it just doesn't work in US drug policy. It just doesn't.
Is that because mothers won't tell a doctor that they're using medications or substances, illegal substances?
Yes, if we take the most extreme case, from 2014 to 2016, Tennessee had the fetal assault law on the books, where a pregnant woman, if they used a substance in pregnancy and the infant was harmed, and that harm definition was pretty broad, including drug withdrawal in the newborn, the woman could be charged with a misdemeanor. What we saw during that time period is people traveling across state lines, delivering in cars. What we know when you criminalize substance use like this, when you make it punitive, people don't seek care. They avoid care. They do things that cause harm to both themselves and their infant because they're afraid. We need to create systems where people can seek the care that they need to optimize the outcomes we want for moms and babies. Fundamentally, this is a national conversation. I don't see this changing until we have federal policy change. We've been waiting for captor reauthorization for a couple of years. This is the law that governs our U.S. child welfare system. We've seen bills in the Senate even make it through committee that really frame shift this issue to a public health approach, and then it died in committee. I think this requires congressional action, and we haven't seen it over the last couple of years. I'm still hopeful we'll see it. Sometimes doing something causes harm. And I think in this case, for some families, potentially families that are very low risk, we're creating harm, as opposed to stepping back and understanding where are the intervention points to truly help families.